Hello, my name is Jordan Landrum. I see that you've received my cover letter for this position, and I would just like to discuss with you about my personal experience in the quality improvement sector. I'm very interested in your position at Desert Regional Hospital for the quality improvement position. Um, I've been a nurse for over 4 years. I graduated in 2011, and since that time, I worked in Indian Health on their med surg floor. And then I worked in public health also for Indian Health, which is where most of my QI experience comes from. I currently work for RES Medical, which is an RN traveler um, group. They provide RNs for hospitals in need, critical access hospitals, urban hospitals that are having staffing issues, and things like that. You would normally think that I would not have a lot of impact on quality and improvement with traveling, but I feel like I've had more of an impact as a traveler because I'm at the bedside and I see numerous hospitals um, at various times. We do 13-week contracts, and so I get to see how one hospital does something compared to how another hospital does something. And that allows me to provide an input that maybe this hospital has a really great way of handling patient complaints, but this hospital has a different way and it's not working out as well. And they know that. Excuse me. So I try to do as much quality and improvement as I can at the hospitals that I'm at. It is sometimes difficult, but I do work as hard as I can to improve or provide an improvement before I leave a hospital assignment. Um, I have been a part of numerous projects to help improve quality and safety in the hospital setting and in the clinic setting. The clinic I worked at, we had a primary care area and then the public health area, and there was not a whole lot of conversation between the two. So I worked with our clinical IT director to provide a streamlined assessment template that would allow physicians and nurses in the primary care area to actually have an easier access to the information that we've provided for them. That way, there's not a double up on what a patient is getting charged for by tests that I can actually perform in the home without the patient coming in for a visit, or particular assessment skills that I've used in the home, or even taking some physical therapy and things like that out into the home to the client has really created a positive environment for change and really allowed the doctors to know what we're doing as public health nurses so that they can understand how to direct us in the future for patients. And that worked out really, really well. Another thing that I did was make sure that our adolescent immunization numbers were elevated. Adolescent immunization, we do really well with kids, but with adolescents that changes. So I developed a program and I developed a presentation for parents to listen to that allowed them a Q&A session so that they could make a more informed decision on what adolescent immunizations they would provide for their child. And in doing this, our clinic actually became nationally recognized by Indian Health Services as having the top immunization levels for adolescents out of any clinic in the United States that works with Indian Health Services. Um, I have a personal approach to quality and improvement, and that is to go to the patient first. The patient is the person who will let us know where we need to improve. And by going to them first, we will get a better idea of what they want to spend their money on, which becomes an important part of the quality and improvement and safety issues is the business aspect of healthcare because we may have great ideas, but they need to be cost effective as well. I really hope that you will consider me for this position, and it's been very nice meeting you, and I hope you have a wonderful day. Thank you.